My name is Nadira Mayweather, Director of Alumni Relations, and I'm so glad that you all have joined us for our Series 2 and what we hope will be a large series of alumni featuring alumni for our GCSU Alumni Lifelong Learning Series. This is a collaboration between Alumni Relations and our College of Continuing and Professional Studies, and I know Professor Crisco is going to correct me on that because the name, they're doing fabulous things over there and I want to make sure that I get it right. So I'm going to pitch it over to you, Angela.
I am Angela Crisco, Executive Director for the School of Continuing and Professional Studies. I do still hold a faculty line in the Department of Communication, but I am currently not teaching. So I'm excited to see some of our Mass Comm alum on our Zoom call today. And for everyone that was not Mass Comm, we're glad that you're here as well. We have an exciting program for you. So I'm going to turn it back to Nadira so she can introduce to you our guest speaker, Dr. Emily Bailey.
And this collaboration was birthed out of a desire for us to make sure that we're continuing to offer benefits and opportunities for our alumni to grow, expand, and find ways to give back and share their content knowledge that they've had since they left the institution. So we're super excited, and I'm very thankful from an alumni relations standpoint that College of Continuing Professional Studies is doing this with us. So thank you so much. Here with us today, we have Dr. Emily Bailey, and I was super excited that she was willing and available to do this session with us. Dr. Bailey is a licensed clinical psychologist in Georgia, and through SciPact, she's the founder of Atlanta OCD and Anxiety Treatment LLC. Dr. Bailey obtained her doctorate in clinical psychology at Mercer University. Currently, she provides individualized evidence-based treatment for children, adolescents, and adults with OCD, OCD-related disorders, anxiety disorders, parenting-related challenges, and other life stressors. She's specialized training through TLC's Virtual Professional Training Institute for Body-Focused Repetitive Behaviors, and in SPACE, which stands for Supportive Parenting for Anxious Childhood Emotions. She's passionate about helping her patients achieve a more meaningful, satisfying, and valued life. In addition to therapy, Dr. Bailey is an assistant professor at Oglethorpe University in the psychology department, where she teaches and engages in research about social anxiety disorders and attentional disengagement, therapeutic alliance, treatment-seeking behaviors, and parental influence on psychopathology. We're super excited to have her here with us today, and she's going to be sharing with us about Beyond the Breaking Point, Crafting Compassion in Chaos. Thank you so much again for Dr. Bailey for being here today.
It's always a moment when people are explaining what you do that you're just like, oh, is that really me? Who are they talking about? So I appreciate the introduction. I appreciate being a part of this today. I think this is an awesome program to get started. I'm excited to talk about self-compassion today. I'm hoping that we give you a little bit of a different spin on what that may look like so that you can apply this to your life and hopefully use it at many points in your life, right? Self-compassion is always something we continue to work on. So hopefully this will be beneficial in many areas. So this is Beyond the Breaking Point, Crafting Compassion, specifically self-compassion in chaos. So as you guys know, I previously attended GCSU, so it's awesome to be here. It's awesome to be talking to such an awesome group of people. Actually, technically, it's an awesome group of alumni. But when I was asked at first to present on mental health and well-being, my mind went in about 1,000 different directions because there are so many things that you can talk about to improve your well-being in life. And there's so many skills that are helpful too. So when I was thinking about where do I go next, right? I have this idea of mental health, mental well-being. And then I thought about burnout. Now, burnout has been a topic that's been discussed so many times, specifically in relation to COVID. That was a time where it really started to blow up. And I think there was a piece of burnout that we often missed. And the piece that I think that we missed the most is that burnout, while it does apply to the job, and while a job can be definitely a place of stress, burnout actually can apply to much more than just your role as an employee. In fact, burnout is often associated with parenting, caretaking, romantic relationships, and what I feel like is the ever-growing amount of chores that we have and tasks that need to be complete after the long work day. And so that's when I thought, we've all been at this breaking point at some point, whether it was COVID-induced or something else. And I think that breaking point for us has all occurred much quicker than it used to after experiencing the pandemic with COVID, and honestly, the transition to online working. If we all have experienced this beyond the breaking point, there has to be some way that we mitigate it and some way that we can some coping skill we can standardly go to. And so I thought we need to start finding self-compassion, some balance, and some sort of a fulfilling lifestyle amidst the chaos that is bound to be happening in our lives. So with that being said, and that introduction, I'm going to go ahead and start the actual presentation. And this is a quote that really helped guide me through the process of creating this presentation for you guys. So many of us have been running all of our lives, practice stopping. And I want to emphasize the practice stopping part. It's inevitable in life that we're running around from jobs to work, to home, to school, whatever that may look like for you guys. And what I want to preach today is we need to stop, but not just practice stopping in a general sense. We need to practice stopping with intention, stopping with an intention to build a more meaningful life so that we don't become burnt out. So we stop the problem before it really even starts. So as you guys know, I'm a clinical psychologist, and given that I'm a clinical psychologist, of course, I'm going to bring up the Rorschach ink blot test. Now, I don't know how many of you have heard of the Rorschach ink blot test, but this is a projective test that psychologists sometimes use in treatment to further assess people. And one thing that we do with that is we essentially show somebody an ink blot. And when we show the person the ink blot, we ask, what do they see, right? What comes to mind when they view that ink blot? And now, luckily for you today, I don't have time to do a Rorschach ink blot for all of you, but a Rorschach test, but we're going to actually do something a little bit different. We're going to do something that I would term a reverse Rorschach ink blot test. And what I'm going to do is I'm going to show you a word. And in your mind, you don't have to necessarily answer me here. You could use the chat feature if you'd like, or just turn on your mic. But one thing that I think would be really helpful is for you to think of any pictures, even any memes, any songs, anything that comes up when you hear me say the word burnout. So I want you to take a moment, think about an image that comes to mind. Now, you guys are all creative, right? So you may be much more creative in your interpretation than I do. Maybe this is like a gray washed sort of image of somebody with a stack of papers next to them. Maybe it's something completely different. Maybe it's a match and there's a flame on it. It could be a meme. One of the most popular memes I think of is like the dumpster that's on fire. Take a moment and just think of that image and get that image in your head of what burnout may mean to you. And I want you to take that image, really apply it to whatever role it is, right? You may not feel stressed at your job right now, but it's possible that you feel stressed in some other potential role that you have in your life. Really take a minute and think about how you conceptualize, what does burnout look like for me? And now that we've done that, I'm really going to go into like, what is burnout and how do I conceptualize burnout? Not that there's any right or wrong answers. I will say that the dumpster on fire is probably the way that I conceptualize burnout the most. But in general, burnout can mean a lot of different things and can present differently for each person. So some common symptoms that we may see is somebody who feels physically exhausted, someone who feels maybe even emotionally drained. Often we see people isolating themselves from others, ignoring tasks that need to be completed, feeling very easily overwhelmed, not sleeping well. And oftentimes this comes with this decreased productivity in work and this increased procrastination. Maybe even feeling like you have the world on your shoulders. That's often what burnout feels like. And again, burnout often applies to the workplace. That's inherently where most people speak about it, but also think of those important roles in your life, whether it's work, school, childcare, relationships. And for those of you who maybe are in the mental health field or have worked with people in the mental health field, many of these symptoms sound like depression, right? And there are definitely overlapping features between what burnout is and how depression looks as well in people. The commonalities often are loss of interest, right? You don't want to do the things that you used to, low mood, maybe negative or critical thinking. And one of the distinguishing features between something like depression and something like burnout is that burnout is really tied to the specific roles that we have. So if we took a break from said role, right? If we took a break, we went on vacation, we quit our jobs, which I don't recommend you guys doing, the symptoms wouldn't persist. We wouldn't still feel that tiredness, that feeling of being overwhelmed. Depression, on the other hand, you would feel down in all areas of your life, right? Even if you did take a break from something. So it is very distinct conditions despite having overlapping features. So maybe, you conceptualize burnout a little bit differently. I know I said the dumpster on fire, but I really want to conceptualize this also as a cell phone charger. I think that's another image that I picture whenever I think of burnout. So I want us to take a step back and think about burnout as a cell phone battery. And imagine that your phone battery is in the dreaded red range, right? So you run to plug it in, and shortly after you realize, I have to go run errands. I'm the adult here. I have to do these things, right? So you realize you need to go to the grocery store, let's say, for example, and you grab your phone off the charger as you typically would. And you notice it's not fully charged. It's only maybe been charging 10 minutes, 10, 15 minutes, but it's in the green zone, right? So there's some sense of relief for us there. Even if it's only at 21%, all we're really focused on is that green piece. Like, oof, we're okay. We're in the clear. But that green, that's a false sense of security for us. And it's sending us a signal that everything's okay, but we have to remind ourselves we're just barely in the green. Realistically, it would take us very little to go back to red, right? Maybe just a few texts. Even though we're seeing this 21% battery charge and we're so close to red, we continue to use our phone as if it's just totally fine, fully charged, it's on green, right? And I want to compare that metaphor, if you will, to kind of just real life. There's so many times we try to figure out how to get or barely get back into the green in our daily lives. Maybe this involves a quick nap at lunch, getting a donut at Dunkin' Donuts on your break, picking up Chipotle for dinner so you don't have to cook. But sometimes those little strategies aren't effective in fully recharging us, right? They may give us that 1 to 2 battery increase or percentage increase, but they don't fill us up all the way, right? So a lot of times I think of burnout as the equivalent of us plugging in our phone for a really short amount of time, or plugging our phone in, but realizing it wasn't actually plugged into the wall, those horrible moments. So when you think of yourself as an employee, as a student, as a parent, as a caregiver, right? A partner, we prioritize those around us to the extent that it completely drains our battery. We ensure that other people's needs are met. And this also leads others to believe and have a false sense of security in us that we aren't burnout, right? Because we can do these tasks, right? And we're doing these tasks on behalf of other people, probably because we care about them or it's something related to our job. But oftentimes we're doing it at the expense of our battery and at the expense of taking time to recharge ourselves. And once you actually tell people that you're feeling a little bit burnt out, they often react in a little bit of a confused way. Maybe they'll say same here, but they can say, oh, but you did this task fine. Like, why is this causing you burnout? Or why can't you do this one thing? Fill in the blank with a task that you have to do. And it's just not the same, right? Some of the tasks that we're asked to do just deplete our battery even quicker. So in our society and in just our daily lives, what I've often seen when I have clients coming in or just in daily life is that we keep trying to get back to the green, that charged battery, but we're not even allowing ourselves to fully recharge. We are literally just okay sitting at the minimal green level in an effort to help other people. And in some ways, it can also harm ourselves. In general, we're not fully recharging. And that's something that we need to do in order to prevent burnout. So to prevent burnout, to mitigate the effects of burnout, it's really important to understand the burnout cycle and really how do we break the burnout cycle. And it seems counterintuitive, right? Most of the things that we do to free ourselves from a stressful state of mind or even from burnout at work may in the short term be so effective for us, but in the long term actually wind up hurting us more or causing more stress. So without even realizing it, humans in general try to change their feelings of stress and discomfort. Negative feelings aren't great, right? They're not fun to feel. And so often we try to push those away. We try to find strategies to make it stop, right? Make the stress stop, make the discomfort stop. And that can look different for everybody. And one of the ways it may look for you is maybe you get so many emails in a day that you end up working late into the night and just respond to emails after dinner while you're watching TV. Or maybe you're just endlessly scrolling in hopes that no one notices that you're not returning their emails. And while these strategies seem really effective in the moment, they can actually add fuel to the burnout that we already are experiencing. And when we experience these meaningful roles in our life, whether we're an employee, a partner, a parent, even an athlete, right? We will experience discomfort sometimes. It's inevitable that discomfort may come up in our lives. And oftentimes, this can be related to our culture, right? So if you look in the corner, it's a battery that's kind of to the side. It says context. And under that, it says culture, systemic, or environmental stress. We often live in a society that preaches like this hustle culture, right? Like if we're not being productive, what are we actually doing? Or we live in a society that preaches only feeling happy is okay. Like if we're feeling something uncomfortable, then something is wrong fundamentally about us. So ultimately, a lot of what happens in our culture shapes how we view not only negative emotions, but how open we are about talking about it and what we do moving forward. So let's say we start with context, right? We start feeling stressed, overwhelmed. We're reminded that we should be working harder, being more productive. We don't need breaks. Let's say that's what the culture and society is preaching. From there, we end up feeling more stressed, right? We end up placing values and placing these beliefs on ourselves that may not fully align with what we believe, right? We actually may believe that we deserve a break, right? And once we start feeling those negative feelings, that stress, we again use strategies to either avoid or change the distress and discomfort. And I don't want to say all of them are unhelpful. I'm sure that some of them are actually productive and are helpful in the long term. But sometimes when we're at the point where we're already so burnt out, sometimes those strategies aren't effective and they only bring short-term relief. And the next morning we wake up and unfortunately we're stressed again and we start feeling dissatisfied, maybe even disconnected from the people around us and experience burnout, which only leads to more stress. So it's a vicious cycle. So let me walk you through an example. So if I live in a culture that promotes the hustle, which I do, and being productive, I may feel shame, right? That negative emotion about feeling overwhelmed by the amount of emails that I get or that I have to respond to in a day. So I'm feeling multiple emotions. Not only am I feeling overwhelmed, there may be a sense of guilt. There may be that sense of shame, right? And that feeling of stress may, for example, lead me to want to just scroll endlessly on my phone at night or procrastinate opening up my Outlook, right? And when I do those things, I for sure experience relief from the discomfort, right? I'm not engaging in the emails. I'm not even looking at the emails. I'm scrolling through something that's probably more enjoyable. And this relief is incredibly reinforcing to me. Like I'll probably want to do it again. I'm not feeling stressed in that moment. But in the long term, if I continue to procrastinate by scrolling or just by avoiding my Outlook, what's going to happen? I'm going to get behind on my work. And that's largely unhelpful, right? In the long term. And that makes me feel dissatisfied with myself. Maybe that makes me feel exhausted in other ways. And the cycle begins again, right? Or if I feel so overwhelmed and so I spend hours at night, my strategy is spending hours at night catching up on all the work. And I decide I'm going to skip my workout. I'm not even going to cook dinner tonight. I'm just going to eat a protein bar. If I skip the things that I usually engage in so that I can complete the work that needs to be done, I may feel relief temporarily, for sure. My anxiety may go away, until the morning, right? I may feel relief that night, wake up the next morning to 100 new emails, right? The next day, I recognize I didn't give myself a chance to actually recharge because instead of doing something I enjoyed, like an activity or cooking dinner, I ended up just scrolling through my emails and answering every single one, even though I'm off the clock, right? So I feel exhausted. That's two examples of how kind of burnout can manifest. And again, everyone's burnout looks a little different. So if those examples didn't match your experience, that's okay, because we're about to make you do this. You definitely don't have to give any information. This is for you. This is for you to think about, you to process. And I want you to take a minute and think about your own experience with burnout, even if your burnout isn't right now. We could think back to COVID. We could think back to a few years ago, whatever the time frame is. And on a piece of paper, in a Word document, whatever you have around you, you could even think this in your mind if you're on your phone and doing something else. I really want you to think about the answers to these questions that I'm about to ask you. And I'm going to kind of lead you through your personal burnout cycle. And I want you to identify things that may be helpful or unhelpful that you do, and that could contribute to burnout. So the first question I'm going to ask you, and don't worry, I'll give you some time to think about it, is what cultural, systemic, or environmental context factors add stress and discomfort to your experience? This could be the hustle culture that I talked about. It could be the belief that when you're a parent, it's like really hard to have a life outside of children, right? But it could also be other vulnerabilities, things like chronic illness, right? Was something stressful going on prior to the straw that broke the camel's back for you? Were you more vulnerable at that time? Were you more sleep deprived, tired, sick? Was it a really stressful time in terms of money, right? Take a minute and think about some contextual factors that may contribute to those negative emotions that come up associated with burnout. And then related to the environmental context, what uncomfortable feelings did you experience? It doesn't have to be the emotions that I listed, right? It doesn't have to be stress or overwhelmed or shame. Think about the emotions that come up when you think about being burnt out or in that context. Think about the sensations that you had, the thoughts that you had at the time that made it really hard to function, that made it really hard to stay motivated. And think about the strategies that you did to try to remove that stress, to manage those negative emotions, right? Were there certain behaviors that really were helpful? Were there things that were more helpful in the short term than the long term? What made those things reinforcing to keep doing? And what were the long-term consequences, right? Did any of the strategies you used just backfire and lead to more like dissatisfaction or disconnection? Did any of them add fuel to the fire by increasing chronic stress or increasing your burnout? Were some things just not effective? And again, this is personal to you. It's not something that you need to share. And this is also something you can consider anytime you're starting to feel burnout, is walking through this cycle. because by acknowledging what's happening in the cycle, we can more easily break the burnout cycle. Now, there's a lot of things contextually that could lead to burnout, right? And I'm going to talk about a few more ingredients that may contribute to burnout so that you guys can identify even more readily what may be causing the burnout in your life or what caused it previously. What leads to burnout? So the most obvious and perhaps the most widely discussed ingredient to burnout is workload. Often workload seems very unmanageable, and this may be solely related to career or the workplace, but it could also be a combination of school, time at work, chores at home, relationship difficulties. Either way, it feels out of balance. Something's out of balance. And this increased workload really did skyrocket during the pandemic. And, us being available online pretty readily also contributed to this. In fact, research shows that in the past 5 years, work-related pressures have increased, and most people state that tight deadlines are one of their biggest concerns, and one of the things that leads to burnout. So workload is probably something you recognize. Next would be perceived lack of control. That's often associated with feeling micromanaged at work. But if we zoom out a little further and consider something more than the context of the workplace, it can also relate to our inability to fully know what's going on and happening in the world, or inability to control what's happening in the world or the outcome. It's a feeling of uncertainty of what may happen next. It may also be related to feeling like you don't have the resources you need and having uncertainty about how to attain those resources. There's also a lack of positive reinforcement, right? Not having your hard work acknowledged, but focusing on the negative, the mistakes you make, whether that's in a friendship, a family context, or a work context, which lends itself to unsupportive relationships, people that aren't necessarily seeing what you need. And lastly, there's a values mismatch, which is what I'm going to be emphasizing for the majority of the rest of our time together, is this idea that sometimes our values in our work life are out of line. And there's ways that we can fix this. So moving forward, we're going to be talking about how exactly can we start mitigating burnout by emphasizing our values and what's most important to us. But Emily, why focus on values? That's the question I hear you guys asking. Well, the underlying reason I want to focus on values as a way to deter or reduce or even prevent burnout is that living a values-based life is a way of showing yourself self-compassion versus the self-criticisms that often come out during the burnout cycle. In this burnout cycle, we obviously have talked about experiencing negative and distressing emotions that we truly just wish would go away. And as a psychologist, I feel like I have to mention that all emotions are a part of a normal human experience and they're okay and they provide us important information. But I also know that a lot of people try to use strategies to avoid experiencing these negative feelings, right? The disappointment, the stress, the feelings of being overwhelmed. And when we try to use strategies to avoid these feelings, it often results in us being pretty self-critical to ourselves. Even the inability to complete tasks in a way that we want to complete them, or, the shame that maybe comes with not being able to fully attend to what your son or daughter needs at that time while cooking dinner or doing 1,000 other various chores, right? That can result in us being self-critical. Statements like, I should be able to do this, or why am I feeling this way may come up. So my goal when we try to focus on values is shifting this. Criticizing ourselves adds fuel to this fire of burnout, right? So if we shift this feeling of like not being enough, beating ourselves up, then we can actually start living a life that's much more meaningful and have a fuller sense of well-being. Often the traps that I hear when people are in this self-critical mindset, I guess you could term them burnout traps, right? Is this idea of self-pressure, like, oh my goodness, I'm too busy to take a break. Like, I'm only worthy if I'm productive. Or it comes up as worry, like something bad is going to happen if I don't address this issue right now, or I'm going to completely forget about it. Blame comes up, right? It's my fault. I should be able to handle this. Even guilt. Like if I don't do this, I'm going to burden my coworkers, or I'm going to burden my partner, or better parents are doing this, but I can't handle it right now. Right? All of these are self-criticisms that leave us feeling pretty stuck in that burnout cycle. So we want to shift that towards self-compassion. And I know you guys know what self-criticism is. I know that we're all guilty of being self-critical, but what exactly is self-compassion? There are a lot of misconceptions about self-compassion. Oftentimes people view self-compassion as something that's a weakness or like self-indulgence, and it's not that at all. Self-compassion means that we're not judging ourselves. We're not judging ourselves for our pain, our feelings, our mistakes we make, our failures maybe even. And we're recognizing that the negative emotions and the negative experiences in life are kind of inherent to being a human. It doesn't mean anything about you as a person. Self-criticism will want you to internalize all of those things and make you believe that these mistakes you make and these negative feelings are about you as a person. Self-compassion involves not internalizing those issues. So self-compassion is treating yourself with warmth and care, similar to how you treat your friend. And we're really used to giving compassion to our friends instead of ourselves. So the first step for us to cultivate this self-compassion is asking, what do I need right now? What do I need? That's where the values piece comes in. We may value the work that we do, even if it is stressful, but I want us to think about what other important things are we neglecting that make us whole and make our lives more meaningful. What do I need right now? That's the action piece in self-compassion. And so to summarize that, self-compassion is really an empathic foundation that empowers us to explore what we need and enthusiastically engage in things that are meaningful to us. Engaging in our values is an act of self-compassion because we are intentionally meeting our needs as a person. It's recognizing that our needs are just as important as the tasks we have set out for us, the roles that we have, and that we also need to fill our cup up to perform well. So to break this idea down even further, there is a yin and a yang to self-compassion. And the yin element involves being with ourselves in a compassionate way. I think this is the standard way that most people think of self-compassion, right? That soothing, validating, warm hug type of compassion. Being kind to ourselves is essentially what that component is of self-compassion. But what most people don't recognize or they forget is that there's also an action element to compassion. And that is really what links self-compassion to this idea of values-based living, pursuing the things that we value most. And this involves protecting, providing, and motivating ourselves to make changes that we need. So sometimes self-compassion sounds like yelling no or just saying no firmly, right? Sometimes it involves setting a boundary. Self-compassion sometimes means not being complacent, not wanting things to be the way they are anymore. Sometimes self-compassion is recognizing to yourself that, I think I need to change because I'm harming my future self or myself right now by continuing to do what I'm doing. Self-compassion can look a lot like tough love on yourself, right? Tough self-love. And so how do we act in a compassionate way to ourselves? By motivating ourselves to change and be more aligned with our values. Values are what we stand for in life. It's how we want to behave. And when we think about our values, we should think about the type of person we want to be, how we want to grow, right, as a person. Not to be confused with goals. Values and goals are two separate things. And if you want to think about the differences between values and goals, I'd really use the metaphor of getting married versus being in love. If you want to be loving and caring towards a person, that's a value, right? It's ongoing. It's a way you want to behave the rest of your life. At any moment, you can choose to either be loving and caring towards someone, or you can neglect that value. Getting married, on the other hand, now that's a goal, right? That's something you achieve, even if you neglect that value of being loving. And so when we think about values, you don't necessarily achieve a value. It's something that you continue to work on throughout your life. It's something that's meaningful to you, that you want to carry through life. And I want to pause because I know all of you probably have values that you consider so meaningful and so important. And you also had barriers to engaging in those values for whatever reason. And those barriers, there's no right or wrong answers. All of us live a very different life. But I think it's fair to explore those barriers. I want to acknowledge that even though it is fair to explore the barriers, there may be parts of your life that you're missing or losing out on when you decide to use barriers as a reason to not try to engage in values that you care about. So oftentimes we break barriers down into internal and external barriers. And these are exactly what they sound like. Internal barriers may be thoughts, feelings, sensations, thoughts like, I can't do this, feeling anxious, having increased heart rate, maybe even. External barriers, on the other hand, are more contextual or situational aspects of life. We have less control over the external barriers, but we can learn how to respond to the internal barriers, right? And put energy into the things that we value. So ultimately, we can improve our well-being. So thoughts like, I can't do this, to I'm going to try, even if it's hard, can make the world of difference. So I want to take a second. I believe a PDF of some sort was sent out with an activity. It's completely okay if you don't have that right in front of you right now, no shame. But this is a values exercise that I often do with some of my patients. We're definitely going to do a shortened values identification exercise right now. And here you see in this picture, just some pictures that would depict something you could potentially value, right? Like adventure, building connections, volunteering or contributing in some way, maybe even continuing your education. Maybe you value family or having fun or spirituality, exercise. And what we're going to do is a very shortened version. If you have the worksheet or have the email, you can pull it up. I'll also be showing it on the screen, although it may not be as readable. But I want us to do this exercise I'll give about 2 to 3 minutes, which is very short. Please continue this after our talk, but to look at the list and really check off values that you think are most important to you. And really, you could stop at the first 15 that you check off. But I really want you to start considering, what are the things that I value? The first step in knowing what we need is understanding, like, what is important to us. So again, I apologize if this is really small. I'm hoping that you guys all have the handout. But here you're going to see that there's a lot of different values that we can list off that may be important to you. So I'm going to give you about 2 or 3 minutes to hopefully either look it over on this screen or look it over on the email. So I'm going to set a timer for that and really allow you guys to look and check off what's most important to you. And it's okay if there's multiple. Now, I know you guys may still be looking over this, but I want to also move on to step 2 if you've already checked off some. I want us to take a minute and sort them in terms of relative importance. So which values are very important to you, which are just important, and which are not as important as the others. I'll give you about another minute to do that. And next, I really want you to take a minute and pause. Think about what values you may have selected in the moment and identify the ones that feel deeply connected with who you want to be. Just double check with yourself, right? Ask yourself, are some of these values things that I want, or are they things that others think that I should have? Or are they things that maybe I feel like society is placing on me? It's completely fine if they do align with who you want to be, but just double check, take a moment. And for those values you're identifying as who I want to be, or those that are deeply connected to you, I want you to prioritize those. So I want you to rank those from the most important to work on, so high priority, to low priority. Some are probably more relevant now than they would be at other times in your life. So keep that in mind too. And now, based on those values that are higher priority for you, again, it's okay if you haven't made it here yet, but for those that are higher priority, I want you to sort them again. These are your core values. I want you to sort them from most important to least important. And it's important to recognize that this reflects how you are right now. This is subject to change, right? You're not stuck in these values forever. They're not written in stone. Different values may be prioritized at different points of your life. So it's perfectly okay to have the values you have right now. I know we're speeding through this. This is usually like a full session, if not more, when I'm working with patients. But now I just really want us to pick one. Pick the one that you feel is most important, maybe, or pick the top 3. And I want you to try and start placing these values on this bullseye. As you can imagine, the closer you are to the center of the bullseye, the more consistent you are in living your values, right? The further away you are from the bullseye, the less consistent you are, right? Pick maybe 3. Where are you lying? Are there ones that you feel like, wow, I am killing it in this category. I'm doing awesome. I am on top of it. And are there others that are questionable? Maybe you forgot about, or you haven't thought about. Things you want to grow, areas of growth for you. And it's completely normal for a value that's really important to you to also be on the outer edges, right? We have very hectic lives. This is a moment where you can show yourself self-compassion and not be critical of like, oh, I should be doing this, right? I know that's the urge that comes up when we're not completely in line with our goals. So the real question is, knowing that you at least briefly looked at the values list, right? At least briefly were able to select some that were important to you. I want us to make, a compassionate commitment right now about these values. With one of the questions being, how do we first know we are living in these values? What actions or behaviors and values are in alignment with what we're wanting in our lives? So even just picking one, picking a simple one maybe, and writing, how would I know if I was actually living my life in a way that supports this value? For example, if I am really big into health, if that is a value of mine, maybe one of the behaviors is I make a homemade meal once or twice a week, or I go on a 30-minute walk once a day. And once we're able to identify the behaviors that support our value, we can make this compassionate commitment. And I'm saying compassionate commitment and not goal for a reason, right? Oftentimes, when I say goal, people just view it as something they check off their list, right? And once they check it off, they often even minimize their ability to engage in it. Like, of course, I was able to do that. It's easy, right? Or on the opposite end of the spectrum, if they don't do the behavior they set out to do, then they feel really self-critical. I want us to take a step back and realize that even identifying behaviors that align with your values is progress to be made, right? Maybe having a mantra of, I'm going to lean into the discomfort of prioritizing myself before other people right now, maybe over my job or insert other important thing, in honor of living a more fulfilling life for myself. I'm going to lean into that discomfort of prioritizing me and start embracing it. So I want to leave us with a self-compassion exercise, and then I'll open us up for questions. And take a moment and really tie this all together in a way that allows us to focus on prioritizing ourselves, our needs, versus prioritizing aspects of our life that lead us to burnout. Identifying your values and acknowledging that you need to take a step forward and prioritize certain areas of your life is a bigger accomplishment than most people think. And the next part, which is changing or making a behavior change, is harder. So let's take a minute and think about how self-compassion may be integrated into this process. And I'm going to be asking you to come up with some phrases. These are things that you can also come up with later because I want them to be genuine to you. I want them to be in your words. But the first thing is just to think of a situation in your life that you would like to change. It could be something from this exercise today, or something else may come to mind. Maybe you want to exercise more, but you can't get the willpower to follow through. Or maybe you have a habit of responding to email after hours and you would like to make a change in that. Maybe you're in a relationship that you want to change in some way, but you haven't been able to do that yet. Take a minute and consider, what change do you want to make in your life? And after you choose whatever change you would like to make, I want you to notice what feelings come up for you when you think about making this change. Maybe there's shame for not having done anything about it yet, right? Maybe there's excitement about the possibility of doing something different. There could also be fear, frustration. Allow whatever you're feeling to come up for you right now. And try not to focus on the storyline, right? The storyline of how to make the change or why you haven't been able to make the change. When you're trying to notice your feelings, also feel those physical sensations, right? Maybe the tension in your body. Whatever your body feels, drop out of your head and the explanations and the planning and just feel the feeling. Most therapist thing I could possibly say right now. Now, we're going to come up with a series of phrases that you can repeat to yourself silently that are really designed to encourage you to change with a self-compassionate viewpoint. And the first thing is mindfulness for the vision of change, right? What you need to change. So maybe having something like a statement such as, this is what I want to do in my life, or this change is possible for me. This is a change that I envision for myself to better me. Some mindfulness for a vision that we want for ourselves, some sort of change. And then I really want us to focus on common humanity as the second phrase you tell yourself. Think about, maybe how difficult it's been to change, right? And recognizing you're only human. People get stuck. People get things wrong. We make mistakes, and we can learn from those experiences. So thinking of another statement to add to the last one of maybe, it's okay, I got things wrong. Or sometimes I get things wrong before I get them right. Or I can do this differently than before, even though it's hard. And the last component before we close for today is I really want you to take a deep breath and add in some sort of physical gesture. Maybe this is putting a hand on your shoulder, like you might a friend or a child. Maybe it's like a fist bump or a thumbs up. We want to use kindness to support ourselves. We want to encourage ourselves to change, right? We don't want to tell ourselves we're inadequate. We don't want to tell ourselves that we have to change, right? We want to add warmth. We want to add conviction. Like, I'm here to support myself. Whatever happens is okay. Imagine maybe what you'd say to a close friend who's also in this position. Pick a tone of voice that's warm, that's calming. Think, I have my own back and I'm here for myself. And we want to try our best to make these changes. So really letting this encouragement and recognizing we need this encouragement to make the change rather than being critical, because being self-accepting, being self-compassionate rather than self-critical breaks the chain of burnout. Okay. Well, guys, I guess it's time for questions or comments.
Dr. Bailey, thank you so much again for being here with us to share very, very helpful information. I know I took plenty of notes, and I hope that our fellow alum feel the same and definitely need to go back and reflect deeply on some of these things, but definitely a helpful start for this. Are there thoughts others want to share, questions, and also feel free to utilize the chat? So there's a comment in the chat. This was very insightful. Thank you for the presentation. Took some good notes as well.
Thanks, Mason and Taylor. I'm glad you guys came. I appreciate it. And you guys can always follow up. I know the end was a little bit speedy, but you guys can always follow up with me if there's questions about the exercise. I can definitely send out my contact information if you need help in guiding through this, right? It's hard to clarify in that moment. I think most of my patients spend like about an hour trying to sort through their values and what's most important to them. So it's a process, but it's a first step forward to making sure your well-being is at the forefront of your life.
Thank you again. I know we're almost at time, and so just wanted to give Dr. Bailey any final opportunity to say any closing comments, and we'll wrap up.
I think this was awesome. I appreciate you guys letting me talk. I'm all about bettering the Bobcats, so I definitely am ready to see what you guys have in store for us coming up. So I appreciate you guys doing this series, and I appreciate everyone who came today.
Thank you, everyone. Well, we will officially wrap up. Y'all have a great day.
Bye.
Go Bobcats.